Good morning, Boca Suites team members. Thank you for joining this quick tutorial on our health insurance open enrollment. My name is John Claudio Planzo. I am your health insurance representative with Insurance Office of America. I appreciate you taking a couple of minutes with us today. We are currently in open enrollment team members, and what that means to you is that it is your time of year to be able to make any kind of change that you would like to your medical plans with your employer, Boca Suites Hospitality. So if you are kind of considering joining the health plan, now is the time to do it. If you are on our health plan and you'd like to make any changes, this is also a great opportunity for you to make any changes. You can add your spouse, add your children, take your spouse off, take your children off. It's really your open enrollment, and even change plans. So it's really your open enrollment to decide what is best for you and your family. I do want you to know that when it is your open enrollment at your employer, that means that it is your open enrollment for your entire family. So sometimes folks say to me, hey, John Claudio, my spouse's open enrollment isn't until January. How am I ever going to get that to align? You don't have to, okay? Your open enrollment here opens the door for your spouse to make changes at their employer and vice versa. Later in the year, when it's your spouse's open enrollment, you can make changes to our plan as well. I just like teaching people that because a few folks understand that. So just know that when you hear the word open enrollment, that is your freedom to make changes for you and your family, no matter whose company's open enrollment it is. All right, why don't we jump into this? I'd like to keep this presentation pretty short for you guys and easy to understand. We do a good job at Boca of providing you with a variety of different plans. We are with Florida Blue, which makes me very happy for you guys because Florida Blue, in my opinion, is the premier health insurance carrier in Florida. We have lots of options, as you guys know. We have United, Cigna, Aetna. We have Humana, lots of different carriers in the marketplace. But I'll tell you, I work with all of those companies, and in my opinion, Florida Blue is the most member-centric, the most competitive in pricing, and they have really powerful networks for us so that your doctors and hospitals are most likely in the network with Florida Blue. So with that, let's get started. You guys have actually 4 options to choose from. And leadership and myself have structured this on purpose for you to kind of give you some lower cost options, and then you can gradually move up the scale here to buy all the way up to a silver plan. So this is our bronze plan. Our middle plans are kind of gold plans, and then our silver plan, silver plan, then gold. And really what changes among the plans, guys, is just how things are covered. I do want you to know that the networks are the same for the PPO. So if you do choose a PPO plan, which oddly our bronze plan is Blue Cross's best PPO network. It's called Blue Options. I'm going to show you how to look up doctors here in a few minutes. And then we also have Blue Cross's HMO network, which is also a great network, guys. The thing with the HMO is you get a little bit more coverage with copays, which we're going to touch on, but the network is a little bit smaller. Still a great network, but it is just a little bit smaller. So our 2 networks are Blue Options, which are on our bronze plan, and our high plan. And then we have Blue Care in the middle for kind of our middle-of-the-road options. Okay. So the bronze plan, this is one of my favorite plans that Blue Cross offers. You know, I always say this, it depends on your view on insurance. It's kind of a perspective thing. Personally, guys, I view buying health insurance as, hey, let me pay as little as possible to the insurance companies because it's expensive, right? I mean, we all know health insurance is expensive. This plan still protects you for many different things. So let's walk through a couple of things that are easy to understand, and then I want to talk to you about the deductible. I know you're probably looking at this deductible and thinking, gosh, John Claudio, $5,000, that's a lot. And I understand that is a high number. But in the grand scheme of things, in the medical world, guys, it's not bad. When you think about a heart surgery potentially costing $500,000 or $1 million, $5,000 certainly kind of you get put into perspective, right? So the way this plan works, guys, first of all, I do want to show you that we have a lot of co-pays for things. So, for example, if you need a medication, you pay a $10 copay for any generic medications. Now, on this plan, guys, I will point this out. On this bronze plan, if you are taking any brand name medications, you want to think about that as far as this bronze plan because it does not have a copay for brand medication. So a lot of you may say, hey, that's okay, anything I take is generic, so you're not worried about that. But maybe for some of you that do need a brand name prescription, you may want to come to our next plans, which do have a full prescription card for brand name medications. Okay. On the bronze plan, only certain brands are covered, and you do have to pay 20%. So just to warn you, it's a little bit of a limited prescription coverage on our bronze plan. Okay. Outside of that, we have really good coverage in other areas. If you do need to go to the doctor, it's a $30 copay, which is great. $55 for your specialist. So if you do need to go see a cardiologist, a foot doctor, a dermatologist, you are protected with a copay. And guys, you know, those office visits can cost $200 without insurance, but with your insurance, you're only going to pay this copay $55. Just make sure that you're checking the network and the doctor you're going to see is in network on the plans, which I am going to show you how to do that, okay? All of our plans are open access, which means you do not need a referral to see a specialist, which is great, okay? And for those of you who take the HMO, if you do hear that from a doctor's office, I do want you to push back and say, hey, my agent has explained to me that my plan is open access. I do not need to get a referral to see a specialist. You do not on any of our plans, okay? Preventive care for all plans is covered at 100%, which, guys, this is really important, okay? If you do enroll in the health plan, take advantage of this, everybody. It's really important. For the gentlemen on the call, we can go get our adult physicals, okay? It costs you nothing. Ladies on the call, well woman exams, and if you do have your children enrolled on the plan, all of their well child exams, immunizations, everything is covered 100% preventive. Now, that's my favorite price, right? Free for sure. But guys, the most important part about this is that you are going to get checked out to catch potentially chronic and deadly diseases ahead of time, right? I can tell you so many stories in what I do, guys, that people went to go get their normal physical, they got their blood pressure checked, only to find out that they had really high blood pressure to the point that they were on the verge of having a heart attack because they didn't know that they had high cholesterol or blocked arteries. And guys, the stories go on and on. Please, I know it's a pain, but take the time to schedule your once-a-year exam. I'm telling you, I have countless stories where it has literally saved people's lives. Catch cancer early. Catch diabetes early. Before those things can take over your body and potentially defeat you, you can catch those things early and defeat them. So that's what the spirit of preventive is, guys. It's here for you at no cost so that you have no there's nothing prohibiting you from going and getting checked out. All right, let's keep going. Florida Blue does a great job with this. All of your blood work is covered at 100%. On all of our plans, you pay $0, okay? So even if you need diagnostic blood work outside of a preventive visit, guess what? You're going to pay $0. But just make sure, everybody, to go to an in-network lab. The most popular with Florida Blue is Quest. Quest Diagnostics in Florida is the most popular in-network lab with Florida Blue. But there are others, so I will show you how to check the network. All right, let's skip these deductible items just for a sec. I am going to talk about them, but I want to stick to copays for a sec. Notice also on our bronze plan, I think this is great, that you have an emergency room copay, okay? You have an emergency room copay. So even if you do need to go to the emergency room, heaven forbid, I hope none of you have to, but if you do, you only have to worry about the copay. You do not have to pay the deductible for the emergency room, which is a very special thing about our plan. Most plans on the marketplace or healthcare.gov, that type of service is subject to your deductible. In this case, it is not. And finally, guys, urgent care. Notice also, same with all of our other plans. We have co-pays for emergency room, so on and so forth. And then, guys, urgent care, walk-in clinics. You guys know about these. You can go to Walgreens. You can walk into a Walgreens, and they have a little clinic in there. I'm seeing Publix is starting to do that too. They have little walk-in clinics as well. You can go there, guys, for $60. So if it's Saturday, you're not feeling well, you feel like you have the flu or something, you can go to a walk-in clinic for $60 urgent care. All right? Now, the PPO, John Claudio, why would I buy a PPO over an HMO? Well, guys, like I said earlier, the PPO network is a little bit bigger. This Blue Options network is a little bit bigger, and it does give you the ability to go out of network if you absolutely need to. Now, none of us would want to do that, okay? Because whenever you go out of network, you have to meet the out-of-network deductible, and it's $10,000 to go out of network. Now, it's certainly better than having nothing out of network, and so that's why it's there. But I will tell you, you want to train yourself to always stay in network whenever possible. All right, let me clear the screen because that looks really messy. Okay. All right, so just a couple of differences, guys. Why would I buy one of the other plans? Well, you're kind of thinking about the deductible if you do have to go to the hospital. So you can see on that bronze plan, there are certain things, as well as our other plans, right, that you do have to pay the deductible plus what we call coinsurance, okay? Coinsurance is a percentage after you pay the deductible. So let's talk about that for a sec. Let's talk about a hospitalization, for example, okay? Heaven forbid you end up in the hospital. The way it works is you have to pay your deductible first, which is $5,000, right, on this bronze plan, for example. After you pay $5,000, you do have to pay 30%, and Blue Cross will pay 70%. Now, some of you may be thinking, my gosh, John Claudio, if it is $1 million, like you said earlier, how in the world am I going to pay 30% of $1 million? Well, guys, this is the most important number on this piece of paper, in my opinion, okay? It's your max out of pocket, and this is really why you buy health insurance, okay? Is heaven forbid you do need to go to the hospital. And I'll tell you guys, recently my mom ended up in the hospital, totally unpredicted, and she was in the hospital for almost 2 months. And I'll tell you what, the bill was over $200,000. She only had her $6,000 maximum. So on your plan, worst case scenario, you pay $6,350 in a calendar year, okay? Which I know, guys, is a lot of money. But again, if you owe a hospital $200,000, $6,350 is a good deal, okay? That's the protection you're buying. You can set up payments for this with the hospital. $200,000, you're going to have to sell your house, So with that said, everything that you pay, your deductible, every copay, every single thing goes towards the max out-of-pocket during the year. So you kind of know your worst-case scenario is $6,350 for individual. Next door, this is for family members, okay? So if you put your family on the plan, 2 of you could potentially meet the deductible to reach $10,000. Or 2 of you could potentially reach the max out of pocket to reach $12,700. At any point, you only pay the individual max out of pocket. All right, hope that makes sense. I'm going to give you guys my phone number at the end of the presentation. If you have any questions, just give me a call. We can walk through it together, okay? So once again, why would you buy one of the other plans? Well, you'd just be looking to reduce your deductible, reduce your coinsurance, reduce your max out of pocket, and potentially get some more copays. So notice on our HMO 48, we have a copay for ambulatory surgery, okay? And we also have copays for x-rays and MRIs on this plan. So you may say to yourself, hey, John Claudio, it's kind of worth it to me to pay the extra money to have this additional protection, lower deductible, lower max out of pocket. That is up to you, okay? All right. Down at the bottom, guys, this is the cost for the plans per check. I will tell you that Boca contributes significantly to your health insurance program. They pay for half the premiums for you as the employee. I want you to think about that, okay? So this pricing is after Boca has already covered half. That's how expensive health insurance is in our country right now. Okay, guys? So this is $76.34 per check. We take it out 24 times a year, but you guys do get paid 26 times a year. So there are two times a year that you do not have your health deduction coming out. And then lastly, I do want to let you know that we do take these deductions out of your check on a pre-tax basis, which is great. You guys actually avoid federal income tax, Social Security, Medicare. You avoid all of those taxes by buying your health insurance at work. So even though this says $76 a check, guys, you can kind of knock off 15 to 20% in taxes that you're saving because you're buying your insurance at work. Okay? All right. So those are our plans, guys. Your homework for open enrollment is this election form, okay? It's very easy. You're just going to let us know what you would like to do. Please give me your name here, your Social Security number here, and then here you're just going to check off what you would like to do for open enrollment. Some of you may say, hey, you know what? I'm already enrolled, and I want to continue my coverage, and just let me know which plan you want to continue with. And then just sign the bottom, okay, and date. All righty? Or some of you may say, you know what, I am currently enrolled and I'd like to cancel my coverage, or I'm currently not enrolled and I do not wish to enroll at this time. If you are waiving coverage, guys, we do need your election form back. You have to let us know that you do not wish to enroll at this time, okay? And then just let us know why. It could be cost, other insurance, whatever the reason. Just let us know, okay? We're curious. We want to make sure we're doing the best we can for you guys. And sign regardless, okay? All right, so that's that. If you're newly enrolling, okay, you are not currently enrolled and you would like to enroll, then we do need that election form, everybody. And then we do also need this application, this Florida Blue application. I've got to put your information in the Florida Blue system, okay? So please let me know your information, name, address, etc. If you're picking an HMO, guys, you do have to pick a doctor, okay? No big deal. I'll show you how to do that. Here, let me know which plan you would like to take. Is it the PPO you'd like to take, the 5302? Okay, just write it in here. What you would like to do. Or if you're taking the HMO, let me know the HMO, which plan. If you're enrolling any family members, please list them here. And then on the back, everybody, you will just sign the bottom here that you're accepting coverage. I only need this form if you are enrolling. I do not need this form if you are waiving. If you are waiving coverage, the only thing I need is the election form with you waiving coverage and signing. Okay? All right, a couple of last-minute things. I did want to tell you that within your packet are all of the details of the plan. So we provide this compliance packet for you. It has all of the details of the plan. In case you want to really drill down and look at additional details of each of our plans, they are in here for you. And then, guys, at the very end, excuse me, I'll take you all the way to the end here. At the very end is our contact information. So here I am, John Claudio, and then, of course, feel free to reach out to Jackie. She's your account manager as well. If you have any questions for open enrollment, we'd be glad to help you, okay? All right, last thing I wanted to show you guys is this beautiful island. Now, let me take you here. I wanted to show you really quick how to look up for doctors in network. It's really easy. You come to floridablue.com, okay? I also recommend everybody that you download the Florida Blue app. It's really great to keep on your phone. Your ID card is right there on your phone, and you can easily look up doctors right on your phone. It's a great app for your phone if you would like. Now, on the website, it's just like this. You come here to find a doctor, okay? And down here at the bottom, you're going to pick your plan. So this is what's really confusing. Just remember, on the handout that we were just looking at, I list the network so you don't forget later, okay? So if you choose our Blue Care HMO plan, here it is. Or if you choose our PPO plan, it is the Blue Options Network. You click Continue, and then you can easily look up doctors, okay, via this tool. So I'll just do the zip code, 10 miles. Let's say I need to find a primary care physician. Click Search, and then you can easily see all the doctors that are participating in the plan. And if you really want to drill down, okay, you can actually click on the doctor's name, and down at the bottom, it'll show you all the plans that this doctor accepts. So here's our PPO. Here's our Blue Options PPO, accepts it, and then see, like I mentioned, the Blue Care HMO is still a great network. A lot of doctors accept it as well. So check your doctors, check your hospitals. If the HMO can work for you, it's a great network as well, okay? So that's kind of how you look up doctors very easily. You can search for hospitals, labs, all kinds of different things very easily on the website. I do encourage you guys to log in, again, on your app or via the website. Get in the habit of logging into your member site. There's lots of great tools in there, guys. There's discounts to all kinds of things, getting glasses, gym discounts, and then you can also see all of your claims very easily. You can get your ID cards online. Everything is here for you as far as your health care, and it's very easy to use. Okay? All right, guys, that is all I had for you. Again, if you have any questions, please feel free to reach out to myself or Jackie. We'd be glad to help you. Once again, it is your open enrollment, so feel free to make any changes that you would like to your health care. And thank you for your time. I hope you have a great day.